Folks, thanks for coming on with us today. My name's John Dubas, Premier Marketing, and we'll be spending the next 45 minutes or so discussing a plan to help you make your retail marketing venue investment pay off. One of the things that we find many times with agents who aren't as familiar with the retail opportunity is they think it's an all-encompassing marketing ploy that will get them in front of enough people to be very successful whenever they're staging this campaign. And for the most part, that is part of the reason why an agent would consider such a program, is simply because it's a great way to get in front of a lot of people. We, however, want to make certain that that effort pays off for you as well, as your investment is not just fees associated with certain marketing programs, but also your most valuable asset, your time. So we'll be spending a bit of time today talking about the different retail opportunities that are available to you through our organization at present, and spending the bulk of our time discussing a marketing plan to help you be very successful in what we look to do. Today's presentation is being recorded, and it, along with additional data that we will reference through the course of the presentation, will be sent to all who have RSVP'd for today's webinar. If you would, in the software, there's a section that asks for questions. These webinars are muted to avoid backdraft that we get a lot of times with some attendees. And so if you would use that for your questions, we'll make certain that we get answers for you, if not by the end of the presentation, but then individually with you as you have posed that question. One of the things that we will do also is, as a bit of administrative work, is make certain that that follow-up comes to you in a timely fashion, and we're able to accommodate many of the questions that you have. Our marketing organization, the Agent Success Managers for Premier, will be following up with all attendees to make certain that we answer questions and see what exactly we can do to help you follow up with some of the suggestions we have for you in becoming part of this program. For those of you who aren't as familiar with us here at Premier Marketing, we are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance services to the public through independent insurance agents such as yourself. And we offer contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently celebrated a milestone in our history, our 50th anniversary, which is quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the country. We do so through a full insurance portfolio, including the products you need to be successful in a retail setting, with a full gambit of Medicare programs that include Medicare Advantage plans, Medicare Supplements, and the standalone Part D prescription drug programs. But we also offer a portfolio of additional products that can help you with the folks that you speak to on an ongoing basis as well. And that includes a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. Those Medicare Advantage programs that we offer, well, they're all the national carriers and many of the strong regional carriers in your market that can help you be successful. And these are the core of a retail program, particularly when we go into the open enrollment season, the AEP. We carry that same philosophy over into the Part D prescription drug programs, where the national carriers are available to you through our organization as well, and a full gambit of Medicare Supplements as well as tools that can help you be successful in that niche market within the Medicare world as well. When we look at the Medicare opportunity, you're getting into this program simply because of the retail program, I should say the size of this population is incredible. You've got a standard phrase of, boy, there are 10,000 people turning 65 every month, and that silver tsunami is a great market to work, and that's true. And you can see by this slide, even with basing the market just on age, it's a burgeoning market. That's one that is very, very much a rich field to work. But if you look at it just by age, you're missing part of it, simply because some of the folks don't access their Medicare benefits immediately upon 65 at their choice. And you're missing out on about a sixth of the market, and those are the people under the age of 65 who shop at these different retail facilities as well. So you've got to have a full gambit to take care of a product, to take care of this diverse population. You've got folks with challenges with their health. 2/3 of the population is 3+ chronic conditions. And you have some challenges also with the dollar pocket, or the dollars that are involved, the pocketbook of all this population, where we need to help them budget for some of the things that just seem to be inevitable in life. And they have choices then that they have to be able to honor. First one of which is, or what kind of Medicare they're going to take at all. Are they going to take Part B? Are they going to go for a Med Sup with a Part D program? Are they going to go for the Part C program, the Medicare Advantage plans? You see in a marketing opportunity in retail that the majority of the folks are looking at either a Medicare Advantage or a Part D program more frequently than a Med Sup, but that doesn't mean that's always the case. So we need to make certain that we're addressing their needs, because the agents, well, they're coming in kind of an equal split between Medicare Advantage and Med Sup. So we got to make certain that we have a portfolio of products that help us with everybody we visit with that are Medicare recipients in a retail setting. We also make available to you different acronym guides to help you speak the language if there are certain things that you need some help with in there as well. Keep in mind, these are pretty large documents. I think we'll be able to fit them in on the initial follow-up today, but they are always available upon request as well. So when you look at the retail marketing venue and looking at how you want to make it pay off for you, be a little bit of Albert Einstein here. Contemplate the circumstances that you have with the different programs that are out there, your selection as to a type of program that you're going to work, with which carriers, and then formulate a plan to move on and make that as successful of an opportunity as possible. Because you're looking at retail as a key component of your marketing plan, but it's important to integrate other activity in order to make it successful, not only during open enrollment, but a plan that you can carry through the entire year as well. The choice is, what we have some details on at present are a number of different carrier retail programs: Aetna, Anthem, Baylor, Scott & White, Blue Cross Blue Shield in 5 states, Bright Healthcare, Cigna, UnitedHealthcare. There are others that we learn of all the time, so those will be updated on different webinars. This one will concentrate on the marketing aspect. There's also always, of course, the Walmart program, which, by the way, the second round of store selections ends on Friday, so it's important to speak with your premier marketer about that. But keep in mind, round one, it's for folks that had an opportunity to pick up the store they worked in last year successfully. So you haven't really missed out on anything there. And then, of course, there's the Grassroots retail program that you select a location within your target market, and then we support it much as we would any other retail program. The Aetna program itself, details are still not totally available, but if we go off of history, it'll require, of course, the portfolio certification of Aetna's Medicare product. It'll do filing through their systems 2 weeks in advance of the event. Activity reports will be filed through that same survey at season end. You can choose the hours and days in most markets that you wish to work the kiosk through the weekdays. There are certain markets that offer different marketing support that may require a synchronization of the scheduling in different stores, but in many cases you can be flexible with that. They usually ask for 10 hours a week, and keep in mind these requirements will vary by market. This store information is available through the area market managers from Aetna. So it's important to know the agent manager in your market, make them aware of the fact that you're interested in a retail opportunity, and we can help you with that as well. When you look at Anthem or Amerigroup or whatever the blues are called in this particular circumstance, you're looking again at a portfolio certification. Flexible shifts are available. They concentrate mostly, or have in the past, on Roundy's and Kroger locations. This program does not have an out-of-pocket cost. Didn't mention that with the Aetna program, that will vary by market. Some markets subsidize it. Some ask for dollars out of the agent as well. There's a saying I read in a Western recently that notes that programs seem to have more appeal for the one getting the free lunch rather than the one who's paying for the cold cuts. So it's one of those things where we've got to watch and see what our best opportunity would be. These folks usually require 20 hours a week within the store. Kroger does help to market the agent, or at least they have in the past. There are weekly sales reports with this one available or required. And the start date on this is the 1st of October, as most of these will run. Keep in mind these store locations and the assignment, once again, they're handled through the area marketed manager as well. So it's important that you have a relationship with that individual and that they're aware of the fact that you're interested in a retail setting. Keep in mind with any of these programs, if you don't know who your agent market manager is for a carrier, that might be the first thing we need to correct, obviously, but we can help you determine who that individual is and how you can get in contact with them as well. Baylor Scott & White is a carrier that's only in Texas at present. Last year they had 40-some counties. They purchased another carrier in north central Texas that's a D-SNP carrier. So there's probably greater opportunity with this if you are a Texan or you're going to be working in Texas. It requires this portfolio certification. The times are very flexible. And last year they worked in CVS locations in central Texas. More detail on this to come for those of you who are in Texas. The Blue Cross Blue Shield program in Texas, this is under the HCSC contract, which is also the contract for Montana, Illinois, Oklahoma, Texas, and New Mexico. These are select Walgreens locations, and they had been a standardized workday of Tuesdays and Thursdays with a 10 to 2 shift. This, once again, is handled through an area manager with these carriers. And so if that's something of interest to you, you need to make certain that we hook you up, so to speak. Bright Health is expanding some of their offerings next year. They purchased a program in California. They had been in, I think, just 7 different states in the past. But this is also a program that requires portfolio certification. They support your retail activities in these different stores. So it's very flexible, but you do still get the local market management support. UnitedHealthcare, well, they've been at this for a long time as well. They are a portfolio certification requirement as well. In addition, they have a additional certification in order to participate in the program, as do many of these other carriers. And the activity is through UHC's Be Connected system 3 weeks in advance of the event, and that's where the activity reports are filed as well. You get to choose the days and hours you work in the kiosk per week. There may be certain areas where the area managers will want some synchronicity when it comes to scheduling, but that depends on the market. They usually ask for 15 hours a week. They have multiple stores that are part of the program. The detail on that should be available at the 1st of next month. And like the other programs, these are directed through the territory agent managers. So it's important that we have that relationship with those individuals in those positions and that we ask for and earn their support. keep in mind, of all these carriers that we've mentioned, the majority of them participate in the Walmart program. And when you look at Cigna, that is their point of view as well, because working with Walmart is their retail program. They want us to stress the fact that Cigna is available in the program. Anthem speaks to that as well. But you'll notice the majority of these carriers do also work or offer their product through Walmart. Now, obviously, the Walmart program has been around a long time. Stores are everywhere. What they look for is a contracted organization that can offer a choice model with competitive plans in any of the markets that are available. And they look for a minimum of 2 Medicare carriers. And these are generally the top carriers in the market. UnitedHealthcare, Aetna, Humana are the ones that are most common. But there may be certain markets where other carriers would be to your advantage as well. And as an independent agent, obviously, you don't always want to put all your eggs in one basket. Making certain that you have an opportunity to market what's hot as well can be very helpful to you. Aetna has a ton of participating carriers that are part of their program, and it's a program that works through the beginning of October to a week after the end of AEP. There are certain blackout dates, most notably the Thanksgiving week, and the folks that direct this program regularly schedule conference calls for participating agents. And as I mentioned earlier, the second round of store selection, the first round for folks that hadn't participated successfully in the program in the past, those stores, the shutoff for that is on Friday. Round 3 will happen about a week after that as well, begin. So you have a lot of opportunity here. And with what we're hearing from carriers that are getting us some skeleton details of next year's offering already, there's going to be a bunch of expansion in different areas by a ton of different carriers. And so stores that may not have been in demand as much last year or for last year's AEP might be a much better opportunity moving forward. When you look at the do-it-yourself program, which is what Bright is asking of an agent as well, this is something that you can work with in a market that may have others already speaking for some of the stores that you had hoped for, or you may have a relationship in the community with a center of influence that would make a grand host for this activity in AEP as well. And so this is one of the things that also is available for you year-round. Many times when we don't have the open enrollment period, we still obviously have all those different SEP opportunities, and just changing the frequency of our activity in these programs enables us to stay in touch year-round, but also market appropriately for the demand. So as you select your key location in your target market, you've got a ton of different opportunity there with the folks that you may already work with. And this gives you an opportunity to drive your own operation, set up your own requirements when it comes to the time that is invested in the program. But it's also important to note that it doesn't get you around the certification or certain carrier requirements that you have in order to stage some activity. It does, however, give you also the opportunity to get additional support and differentiate yourself from other agents in your market. It gives you then a jump start on some of the stuff that we're going to speak of here anyway, with marketing support through not only the carriers that you're representing and your upline, but also through different community activity that can be very helpful to you. So in this circumstance, it's important to properly identify the location you want to play in, get your contracting and certification done, train and be ready for it, and work up the success strategy that will carry on for any of the programs that you participate in. There are some trainings that we recommend up front that you do. Obviously, you got to be contracted and certified. That's the first batch. AHIP is actually available on the 22nd of this month. A lot of agents will wait until the carriers roll out their certification process, generally in the first part of July. And one of the reasons for that is to get the discount on that AHIP through the different carriers. NAHU is coming out with a continuing education program that carries across the board as well. It's a question now as to which of the big carriers or who is going to accept that. Right now, that's kind of still up in the air. But that's also something that you need to not only get that initial part of the certification with AHIP or NAHU if it comes about, or one of the other national certification services, but then that gives you then the opportunity to complete the other certifications the carriers require of you. Product certification primarily comes into play. There are a number of other carriers, United, for example, that require you to do a marketing module in order to participate in retail or community activities. So that's there for you too. That's that third button where the optional carrier activity is there for you. For those of you that have been in these retail situations for a long time, that may seem repetitious, but obviously everything is subject to change. And sometimes when you hear something spoken a different way by a different individual, you might catch it where you miss it from someone else. Excuse me. You also feel that it's really important for you to be aware of and proficient at carrier electronic enrollment, and that means going through some of the trainings that they have available. One of the things that our social distancing environment today has taught us is that, hey, the world still goes on, but having electronic enrollment processes and programs in place in order to collect the compliance material ahead of time, that scope of appointment, are paramount to your success. And different agents will have different mindsets when it comes to, if I'm in a retail setting, am I going to enroll someone there, or if I'm going to set up an appointment for later? Having electronic enrollment to make certain that you can process an app quickly in a store, if that's what's the best course of action to take, well, gee, you're freeing up more time and you'll miss a lot less people if you do it that way. Scheduling an appointment for hours that you're not in the store, obviously, also gives you an opportunity for folks that are a little less open about having other people hear their situation. So it gives you that latitude, and it also frees up an opportunity to cross-sell as well. It's important, too, if that you're in a retail setting offered by one of the carriers, they don't normally want you selling someone else's product in that store. So it's important to work the situation as necessary in order to do what's best for your potential client. There are, of course, other programs that come into play as well, like today's, the Grassroots Marketing Community Trainings, making certain that you're proficient in low-income subsidy and Medicare savings plans is also important to make certain that you not only can discuss an individual situation accurately and professionally, it also gives you the opportunity to create a special election period and perhaps an enrollment prior to the annual election period because of the special election periods that may be there as well. We do also offer our own quote engines that help you in addition to whatever electronic enrollment you're using with a carrier. We have a program in play that helps you quote the med subs and cross-sell with ancillary products through our contract with CSG, and they've got a ton of e-apps and e-scope of appointments that are available to you as well. But we also have our Medicare Center that allows you to enroll Medicare Advantage and PDP programs very easily, collect that scope of appointment as well under this program, and like the other quote engine, have a place for you to store that for that 10-year requirement that you have with the scope of appointment. There are also trainings that are necessary for the Medicare.gov guide. The Plan Finder had some challenges last year They're supposedly corrected a whole bunch of those. But to be honest, the Medicare.gov guide, the plan finder, was never required or never intended to be a sales tool. It was an informational tool for folks to access generally on their own. As proficient insurance professionals, we realize a program that has merit and is recognized by the public, so we need to be aware of that as well. And it never hurts to have a Medicare 101 review with yourself in different trainings. We have actually presentations that you can use in some of the other centers of influence that can help refresh your background on all the ins and outs of the program, but also give you a means to present for seminars and other centers of influence. And we'll talk more about that in just a minute. So it's important to note as well that we never put all our eggs in one basket. And as we plant our flag and we have a location made available to us, that is the beginning, the seed for planning for the annual election period and how we can use that to transition to year-round selling in the community. Once we have that location, we then look to identify other centers of influence and interest for the Medicare population in the area around your target hub. So that may be the Walmart or one of the other retail opportunities, pharmacies that you have, or it may be your own do-it-yourself version. We look to identify some key influencers. So we're looking at churches, we're looking at senior centers, we're looking at nutrition centers, we're looking at the living sites and the provider sites in that area around our location. How do we find these folks? Well, it's not as hard as you might think. If you go for some of the faith-based organizations, this website, churchangel.com, is based mostly on the Christian folks, but we have other things we'll talk about in a minute for the other folks of faith. It gives you an opportunity to pull up locations based on zip code and, pardon me for that interruption, and also for a way to map out these centers of influence in the area and give us an opportunity to market not only during AEP and the retail time, but also throughout the year. Establishing a pattern of repetition throughout the year can help us successfully market in our target market the whole time, and it also gives us the opportunity to narrow it down to zip using this website or through other means of establishing a geographical target. The website itself, it lays out some different things for you, giving you address, contact information in there, but it also then gives you the opportunity to create a bit of a, well, showing my age here, the old cigarette machine service route in a particular area, or a candy machine route in an area, where you lay these all out, and it gives you the opportunity to go approach these locations, making them aware of the fact that you're in a standard location in a Walmart, and you're there to help the congregations eligibles with choices in a public setting, and also make available to the congregation that same sort of support in that location. So you're doubling up on some of your marketing activities. It may give you an opportunity to seminar sell in addition to perhaps doing a camp at the faith-based organization as well. If you're looking to market as well to the Jewish community, there are ways of finding the synagogues in an area as well. We have a way of getting you there as well. And then, of course, for the Muslim community, you have a website that can take you into different locations there. One of the most interesting and eye-opening marketing efforts that I put forth in the past was actually in a See, I'm not really sure what they phrase it, but it was a full day service where the men sat on one side of the building, women on the other, but it was a population that wasn't well served by their own ethnicity, and we were looked at, or I was looked at, as a true source of information for folks that don't have as much marketing pressure as well. When you look for additional centers of influence, having the nutrition sites for the seniors available to you is important. This is where having a retail setting makes a huge difference for you, because many of these locations do not allow marketing activity on site. Some do, some will not. This gives you the opportunity to go in with an option for the folks that attend these programs to visit you in a open setting, non-threatening as well, and gives you then the opportunity to leave your information and establish a relationship with the folks that run these programs in your market. You can find some of these through foodpantry.org. It'll lay it out for you, much as what we see with Church Angel, where you're able to find things by address and zip code. There's also a senior center directory, and keep in mind this information will be sent to you so you have the URLs for all of these in the presentation that you'll receive. But it then gives you the opportunity to look for senior centers and retirement centers in your target market as well. Seniorliving.org will also help you establish a route to run for the senior retirement communities in your target market as well. And then, of course, looking up some of the low-income housing units also give you an opportunity to spread your gospel, since many of these may well have a bus, much as some of the other senior residents do as well, that take individuals to the different pharmacies. So that can be a big help to you in assuring folks that you can speak with. It's also important to make certain that you have a idea as to the providers that are in your market. Obviously, as a salesperson, that's one of the things that will come up, particularly in a network-based program, as many of the Medicare Advantage programs are. And it also then gives you an opportunity to market with those providers. We have a webinar specifically for provider marketing, and it, along with much of what I've referenced as well, will be part of the follow-up with a link to those recordings for you. Additionally, you can look specifically for help in an area for a certain provider. So if you're working the UnitedHealthcare program, the Aetna program, or any of the others, utilizing their provider directory gives you an idea as to how you can approach these people in your key market. And then, of course, in other areas, you have an opportunity to also look at the overall population if you want to add in some additional non-network product as well. Same sort of thing will come into play if you're looking at a dentist. And since many agents are proficient at marketing dental programs, if not, we got detail on that. But this is actually a point of contact for many of the carriers that are offering a dual special needs program, because many of them utilize the benefits in their programs for dental services as a key way of enrolling individuals. In addition to utilizing whatever network information that may be part of that program, finding dentists in the area also opens up an opportunity for you, provides you an avenue to pursue dental business year-round. Dental business up front, establishing your book of business, cross-selling down the line, putting them in your funnel, sales funnel down the road. So we're looking at also other areas that are community-based, but more of a population that caters to the senior population. So that includes different blue hair heavens, as I used to call them, different restaurants, coffee shops, beauty parlors, bingo hall, single halls. This gives you other places in the community so you can blanket the area and make yourself known as a subject matter expert for your market. If you're looking at some of those restaurants, there's a bunch of them that offer senior discounts. So I've got a URL there for you to use to verify these, create a hot link with this, and go to some of those that may be located in your area. It's a great way to also broaden your marketing efforts by utilizing some of the marketing support that is available to you through retail at these locations. It's a great way to announce yourself at a particular third area that's non-threatening to a restaurant. Obviously, you're not going to, Denny's doesn't want to take you to IHOP. You don't have providers that necessarily want you sending them other places as well. So having that neutral site, if you're working Walmart, or if they're aware of the fact that this is a UnitedHealthcare or Aetna, Cigna, whomever opportunity, that they know specifically what is going to happen, and that you have marketing material that helps drive the people to those locations. So we look at this as an opportunity to use retail as a base and add on different programs that can make this one sales opportunity part of a comprehensive plan that's effective not only during the open enrollment period, but also one that will work for you year-round. So one of the things that we recommend as well, particularly if you're in a hot location and you want to impress the management of your partner in the community, the retail site, is the fact that you're investing a little bit into the program. You're making the folks at those locations aware of that activity and that expenditure. And it gives you then the differentiating factor that you want to have when you compare yourself to other agents that are active in, finger quotes working, your market. It gives you then an opportunity to create also multiple offices of sorts. If you are one of the agents that work out of your car, if you have a street location for an office in the community, that's great. But it's also a great way for you then to establish your name in multiple locations, that people will look at that and realize that you're very active in the community, and you generally don't have such activity if you don't know what you're talking about. You have an opportunity as well, I'm using that opportunity a lot, to also have publications made available to you through the government as well. They're available in English and Spanish and about everywhere. Some of the other languages not so much, but this is also material that you have available that is permissible in about all of these locations. I say it that way because Walmart wants you to use their material, and if you have a carrier branded material, they want more than one carrier's material out there and available. This is a generic approach. It not only helps you in a standard retail location, but also as you visit those other influencers in your market, having this information available to you to provide folks as part of your pitch as to why they want your material in their location. They look at you as a more of a open-minded individual that's not just pushing one product. You get a ton of material available to you through CMS in order to make it work. Any of these locations or any of the activity that you're using this material in, it's always important to, pardon the expression, pimp your help. Have the carriers aware of your presence. If you're creating your own opportunity or in one of the other opportunities, and make them aware of the fact that you'd like their help if mail is available through that carrier to establish your presence in a store. Some managers in some markets may help you accommodate that, and working with your upline is a great way to do that as well. So it's important for you to make certain that you decide a location that is not only good for you, but good for your partners that you're working with in this initiative. So not just your agency or a particular carrier, but also that location. A symbiotic relationship will get you much further in this circumstance than just, well, I'm here. Stay away from the cold cut aisle. Come talk to me instead. You want to make certain that you're delivering value to all those involved. So one of the things that you're doing with this is you're keeping a journal of every place that you visited, and you're also rendering to them, providing them the marketing material that makes them aware of the days and times that you are in that location. Not the location you're visiting, obviously, unless they do that, but I'm talking about the retail location that you're working. It then is a starting point for you, or a point of conversation with the management of the location that you have. You take to them a journal of your activity, or a listing of your activity, a sample of the marketing material that you're making available. You make it available to the pharmacy manager and to the store manager, so they know that you're helping drive business to them as well. And it helps facilitate that relationship, which is the all too often common denominator of agents that are successful or not. Do they do it or not? Walmart and most of these initiatives require that you check in with the pharmacy department before your shift and check out at the end of it, making them aware of the fact that you're doing this marketing for them, so to speak, makes them much more likely to send people over to your table or to your kiosk or whatever you're using in a particular area, and multiplying the effect of your time in that store. So that gives you then a way of speaking to and increasing the value of the location that you're invested in. Be it a program that doesn't charge you anything at all for the initiative, or if it's Walmart where they ask you to fork over $500 and you get half of it back if you have successfully completed their requirements. Makes you available for the right of first refusal the next year if you're doing all that. But it then gives you a greater chance of having more people visit with you and be successful in that operation, busy in that operation, in order to really garner your full return on your investment. Some of the things we're going to do to help as well, obviously, if it is a opportunity like Walmart or one of the others where you're in a retail setting with a carrier that doesn't completely dominate a market and you need some of the other carriers, this electronic contracting function can help you a great deal. It allows you to create an agent profile of your information, and in many circumstances, contract electronically through this software system. Many of the Medicare Advantage and PDP carriers will ask you to do their own electronic process, so this may not apply to everyone, but in your market, it's important to identify who the key players are. We'll tell you how we can do that in a moment as well, but also then do it as painlessly as possible. It's nothing more frustrating than going through multiple contracts that are 60 pages long. You might have missed an initial somewhere and it hangs you up for a bit until you can figure out what's going on. Well, this will help you a great deal in eliminating that factor. It's also a great way to pick up some of the ancillary product, the dental programs, some of the other health programs that you can still do on that scope of appointment, or look at final expense or life insurance products as well in order to cover your prospects and clients completely. We do also offer discounted E&O, which is important since most of the carriers, the vast majority of them, require that coverage, generally at least $1 million worth of coverage. We offer that through a discounted relationship that we have through with 360 Coverage Pros. And the nice thing about this is it covers you regardless of whom you contract with. We realize as an independent agent, you have an opportunity to contract with a multitude of marketing organizations. This will cover you with any of them unless you take the premier carriers only, at that slight discount with this program. And that way, as an independent agent, you don't have to put all your business with one organization. Sure, we'd like that. So would anyone else that you visit with. But this makes certain that you're covered regardless. We also help you keep your license in play through our relationship with WebCE to discount continuing education programs for you. And we have also an opportunity for you to add to your own benefit package by accessing a modified guarantee issue non-cancelable DI program for yourself. You access it at discounted rates, you share in the commission, and as I mentioned, it's available on a modified guarantee issue basis. So it's a way for you to also cover yourself moving forward. Much as where today's presentation is being recorded and is made available through our website at premiersmi.com or on our YouTube channel, this gives you an opportunity to go in and see and access at your convenience some of the programs I've spoken to and referenced a bit earlier. If you're going to work with centers of influence such as a faith-based organization, we have an approach for that. If you're looking for an opportunity not just to drop off flyers at a provider, but work with those providers, we have a webinar for that. It's a opportunity to look at other programs outside of the retail program and integrate them all into a master plan for your program in your chosen market. This also has different programs or recordings in there for different carriers and their products as well. So that can be very, very helpful for you where you can access these 24/7. One of the tools that I mentioned earlier in order to help you determine what is hot in your market is utilizing the quoting tool that we have with CSG that enables you to pull up the carriers in your market, particularly in the Medicare Supplement area. It gives you an idea of who is most price competitive at present and give you that opportunity then to make certain that you're contracted with them, but also offer a complimentary Medicare Supplement review. Utilizing the information in Medicare Advantage option with PDP programs, it gives you the opportunity to look at market penetration, some of the other things, side-by-side benefits for your training purposes here, and do an e-application across the board. This is one of those where I mentioned that gives you the opportunity to collect that scope of appointment and document it, hold it in the software for that required 10-year period, and give you an opportunity to cross-sell with dental and hospital indemnity. Keep in mind, the one quote option on this that is not a health product is that final expense life insurance. That is the one product that would require, obviously, a cooling off period going back 48 hours if it's an appointment, and it's not something you'd want to discuss in a retail setting other than baiting the hook in the retail situation. Just keep in mind that doesn't benefit that location, and it's not a health product. In order to avoid compliance issues, we want to make certain that we dot our I's and cross our T's in that circumstance. So you've got that electronic enrollment options. You know, if nothing else that COVID-19 didn't do for us is it really gave us an eye-opener regarding the needs of doing some things electronically. And we're providing those tools to our contracted agents without cost. We also make certain that we make you aware of the full financial consideration you should receive by selling these products. And since many of the carriers will offer different incentives, we want to make certain that you have a certain place that you can go to and garner that information, and how those would also apply to the Premier Producers Convention that we offer as well. Keep in mind, Medicare Advantage and PDP programs have compensation levels that are basically laid out for us by CMS. The 21 compensation for Medicare Advantage and PDP programs just came available. That will be part of the follow-up to today's presentation. But those programs don't, well, because they are the compensation set by the government, we can't include them in different types of incentives. There are programs out there that will help you with your AHIP cost and some of the other things, but it doesn't apply to trips or getting paid extra. I say that, and what we see now with most of the Medicare Advantage carriers is the health assessment form, which you're paid separately on. It doesn't qualify you for trips or incentives, but it's a nice way of making additional dollars with the MA carriers by going through that process and being compensated for it. Our trip that we had scheduled for this year that was kind of sunk, no pun intended, because of the COVID situation. We had a cruise set from Miami to the Bahamas, and you'll see that our trip and a lot of the carrier trips were also placed on hiatus for 2020. We'll have more information 2021 coming up. Some of the other things that we can help you in the meantime is we do make contact lists available to you that are butted up against the do not call list. You can't cold call, obviously, for Medicare Advantage or PDP programs, but you sure can for MedSup or the ancillary products. So it gives you the opportunity to make certain that your lead flow doesn't fluctuate too much during the open enrollment and lock-in situation. Those community programs we've referenced earlier about the retail marketing, what we're talking about now, but also the specifics on the different locations. So we're going to have regular communications come out to you as more carriers make the details on their programs available and keeping you up to date with the Walmart situation as well. Some of these carriers do obviously also, if you're in a retail setting, make prospects that they've generated available to you, and the majority of them require that through their lead systems. So that's one of the reasons you want to be very conscious of the fact that your area manager with a carrier can be your best friend, or in some cases a bit of an impediment if we don't handle it correctly, and they will, in many circumstances, push prospects to retail locations. We do have different internet lead programs set up. Facebook leads, final expense program has a great history to it and very effective. The Medicare Advantage program or Medicare program just started. We don't have enough detail on the success stories to be able to toot our horn too much on it yet, but that's the early response is looking very, very good. And we do still offer direct mail support based on production. It deeply discounts the cost of a mailing, and while snail mail can be a bit of a challenge for some folks, I tell you, the population, the demographic we look at, they actually read their mail when it comes, except for, in a lot of circumstances, a piling on during AEP. So differentiating ourselves from our competitors, our fellow agents in the field, can be very helpful. The preferred lead vendors that we have recognized that and really help us and you make that successful. A number of them that really stand behind their product. It's great to see, and it's offered at a very reasonable rate for direct mail with your partnership in production. So what we hope to basically accomplish here today is give you an idea of a way of setting yourself up as a subject matter expert in the market where your retail store location sits. We look to help you with that in order to make you successful with it and make sure that you have available to you the different marketing materials that you can use in that effort. There are ways that in many circumstances a individual center of influence in a community may not want to push their clientele to a Walmart or a Kroger or whatever. Doesn't happen too often, but there are versions then that you can leave them flyers on a generic basis, more carrier specific should you choose to do so, that at least gives you another contact in the community and expands your penetration into your area of propinquity. I've been looking to use that word, your target market. We want to help you with that. So once you've determined that you're going to work retail or you're considering it very strongly, we want to make certain that you realize this program that we laid out to you briefly today Doesn't apply just to retail. If you're looking to own a market and you have an office on the street, or if you don't, whatever, you're in that area, we want to make certain that it can be a framework for you to market year-round as well. And in order to make that successful, you've got to determine that it's an important part of your personal marketing program, and you set it in play. We'll help you do that. All that said, you can reach any of us here at Premier through our toll-free number at 1-800-365-8208, or access information off our website at premiersmi.com. We look forward to the discussion that we will have with you regarding these different programs and the other plans that come into play for you through your marketing initiatives, so we can make that happen for you. As I mentioned, you'll be receiving follow-up from us, and we'll make certain that we help you maximize the return on your investment. I keep beating that to death, but keep in mind that investment isn't just the monies that come into play with this, because, you know, that's kind of painless for a good part of it. I don't want to write the check. That's always a pain in the wallet. But we want to make certain that you have an opportunity to maximize your most precious asset, and that is your time. And minimizing your windshield time by bringing people to a secondary office can really help you do that. And we want to help you recognize that and put the plan in play to make certain that you're being all you can be, to rip off an old Army commercial or whatever that was. So watch for our call. Follow up on the follow-up we send you. If it's something that's of specific interest to you, make certain that we're aware of a location that you're looking at, and we can start plotting this information out for you and that plan before it's underway. That gives you the opportunity to get jump-started on marketing that can help you garner business now. Because keep in mind, these retail programs, vast majority of them, unless you're setting up your own, they don't start till October. June, July, August, September, October, 5 months of electric bills, 5 months of house payments, things we need to do in order to be successful on an ongoing basis now. Give us an opportunity to visit with you in this particular circumstance, and we most certainly will enjoy that conversation. Hopefully so will you, and we can put it in play. All that said and done, I keep talking about how valuable your time is. We're approaching an hour. I want to thank you for investing that hour with us today. Watch for the follow-up, and until we speak again, I wish you good selling. Thanks so very much, and we'll talk to you soon.